Disparities in access to healthcare persist. Minorities, rural, and low-income patients often face barriers in receiving timely and adequate care. Dr. Ala Stanford has seen this firsthand and has written about it in her latest book.
Hey, how are you doing?
Good to see you. I met Dr. Stanford at our office in Washington, D.C. She is the author of the book, Take Care of Them Like My Own: Faith, Fortitude, and a Surgeon's Fight for Health Justice. I loved your book, and it's so interesting because you begin the book by telling a story about a little baby named Grace.
Correct.
And that informs the title of your book, Take Care of Them Like My Own.
Yes.
Tell us the story.
Well, I'm a pediatric surgeon by training, which means 18 years I trained after high school to become a board-certified pediatric surgeon, meaning I operate on babies that weigh less than a pound. It is something that I treasure. It's a privilege. And when you have this infant, or for that matter, teenager, you are taking care of them like your own. You are the surgeon, you are the mother, and there is no one more important than that person in front of you. And so that's why I started the book with that story.
And it's so powerful, the role you have, because this is probably the most vulnerable moment in this mother's life. And she's saying to you, please take care of it like it's your own. And you do. Can you talk about that experience? Because I guess going to work each day and having meaning and purpose in that role has to be like off the charts, I would think.
It is. And that's the emotional part of it. But being prepared means rehearsing the operation. It means making sure you know everything about a patient's history. Even though they've only been in the world a couple hours or a couple days, there's still a history you need to know. It means thinking about what you plan to do and anticipating what might not happen the way you wanted to. And so that you just have to be comfortable and confident before you even get to the OR, or in this case, the neonatal intensive care unit where I did the operation. And then it's a trust. You know, when a parent locks eyes with you and says, take care of my child, or thank you for what you're doing, you carry that with you, you know, in the OR. And you also kind of have a bond because sometimes parents aren't there. Sometimes infants or children don't have a parent that's present. Sometimes they're working. And then it's you and the baby. And it's like, it's me and you, kid. Okay, we want to feel better, you know, we want to get better. We want you to go home. We want you to grow and be a kid and play. And so it's all very emotional. Yeah.
Ala Stanford is an American pediatric surgeon and the founder of the Black Doctors Consortium and the Center for Health Equity. You know, one of the things I thought about reading your book was these are vulnerable people in the worst moments of their life with a baby, and you understand them. I mean, like, if the doctor was me, I mean, I may be a great surgeon, but I don't have what you have, that knowledge base. It makes a huge difference, doesn't it?
I believe it does. It's a lived experience. It's a shared experience. It's that I'm not way up here and you're way down here. Like, I recognize that something different could have happened with my parents. Something different could have happened with my upbringing, where I was raised, the environment that I was raised in, that may not afforded me to go to college and to medical school and train. And so when I look at those patients, I can see myself. I can see an alternate ending to my story, if you will. And I treat them with the utmost respect because we don't know what opportunities may be placed in front of us or what challenges and how we each respond. And I was just fortunate that the opportunities I received, I was able to do something with. Everybody doesn't have that. So I don't see them as lesser. You know?
You talk about opportunities, but there's another O word, obstacles. And one of the things that struck me was, you almost flunk out. And if you read this, it's not because you were a terrible student. It's because you're up against I mean, let's be honest, racism, misogyny, whatever, it's the mixture. You know, part of, you're talking about excelling and excellence, but resilience was a key ingredient of you as well.
So it's multifaceted. One, the people who came before me in the 1920s, 1940s, even my great-grandma that was from Spartansburg, South Carolina, that used to pick cotton for a quarter a day, someone that I knew, she didn't have the access and opportunity that I have, right? And so whenever things seemed tough, I used to think, well, I'm not picking cotton in the hot sun for 25 cents a day from sunup to sundown. So it's hard, but it's all relative, right? And I honestly would think if she had this opportunity, what she may have done with it. And so that's something I carry with me. Even though I had adversity, I was pushing through it because I knew it was finite, that the challenges wouldn't last forever. And eventually, if I could push through, I'd get to the other side.
So during the pandemic, you took immediate action to serve communities that were lacking access to care. What lessons did you learn then, which, you know, kind of broad stroke tells us where healthcare is in the United States?
Well, what I learned from COVID is that you have to go to the most vulnerable, those who are transmitting the disease at higher rates because of the conditions and or environments that they live or the occupations that they have. And if you say, you know what, let them fend for themselves. This is every man and woman for themselves. You can try that. But ultimately, when they are sicker and sicker and sicker, and they, number one, are the ones keeping the city and the nation running because they so often have the jobs that other folks don't want. And number two, when they get super sick and they're filling up those hospitals, it won't matter how much money you have and how good your insurance is. It's going to be the sickest person gets taken care of first. And it doesn't matter how many millions and billions unless you've got your own hospital, your own doctor, your own surgeon, your own anesthesiologist, your own nurses, your own ICU, because that's what you're going to need. And we have a finite number of healthcare professionals and institutions. And if you neglect those who we already know will need it the most, you're either going to pay for it on the front end or the back end. And so my biggest take-home message is that those of us with means are going to figure out what we need. But those of us who are living paycheck to paycheck and can't afford to stay home are the ones that we have to get to first, them and their children.
Even with insurance, many Americans are underinsured, leaving them vulnerable to high medical bills and financial hardships in the event of a serious illness. You know, one of the things I want to talk to you about is you're a professor now, which means you could shape the next generation of healthcare providers.
Indeed.
But also you can be a face that you didn't see when you were going through school. So talk to me about both aspects.
First of all, the students are amazing. They are eager, they're hopeful, their minds are malleable. And so I know that I am instilling in them how to be some of the most empathetic, charismatic, and brilliant physician and scientists. So that's my contribution, giving back to medicine. And also, it's wonderful. I do have lots of women. I have students of color, and when they see me, they're seeing something I didn't see when I was in college. And so that feels good.
Yeah, it makes a big difference to them too, I imagine.
It does, and they are enthusiastic, and I'm gonna give them a tour. We're having a field trip out to my medical office, so they'll get to see the communities that we're shaping, and hopefully will continue to inspire them. And how about the textbook for the class is my book, Take Care of Them Like My Own.
Oh, fantastic. What gives you hope?
What gives me hope is the next generation. What gives me hope are media folks like yourself saying, I want to interview you. You have a story that people want to hear about, and I hope that will inspire them. What gives me hope are my children, and that I still believe at the heart of each individual that we aren't so individualized, that we really want the best for everyone, that there's good in people.
The healthcare system often prioritizes treating illnesses rather than preventive care, leading to higher long-term costs and poorer health outcomes for chronic conditions like diabetes and heart disease. Well, let's talk about the ecosystem and the healthcare system, because I think you just pointed out when the pandemic hits, these people are hit really, really hard. And yet, if I'm wealthy, I can get concierge and pay extra money, and I can have a doctor, I can call them up and get in. So can you talk about kind of the healthcare landscape and just how it's tilted kind of in an unfair fashion, I guess?
It is. And I believe the Affordable Care Act was an attempt to mitigate that, to make it a little bit more even. The tough part about it, as we're talking about our healthcare landscape, is that some of the healthcare systems, I won't name doctors specifically, couldn't afford to bring lots of folks with CMS products, so Medicaid, Medicare, and so forth, because the reimbursed rates are so low. So in order to keep their institution viable and sustainable, they need more private payer folks. So I won't name them all, but the ones that pay better reimbursed rates. And so what it gave you was some healthcare insurance, so you could get a prescription filled. You could get scheduled for a procedure or an appointment, but it didn't mean it put you at the front of the line. A lot of times it meant you were waiting weeks or months to get in to see the docs, right? And so it is skewed. It's like most things in society, haves and have-nots. And the haves have most, and those who don't have the least. And they're the ones that often suffer. And you didn't ask me how to fix it, but it's the title of my book. Take care of them like my own. And if it's good enough for your spouse, for your child, for someone you care about, then it should be good enough for the person sitting in front of you.
This Black woman arrives, you assume she's there for testing, but no, she's there to see you. Because, as you point out, you're an anomaly. Only about 5.7% of medical doctors in the U.S. are Black. You see what's going on in those communities because you actually grew up in it. Whereas the healthcare industry, I think a lot of people are removed and they don't. What do we miss because of that?
We miss a ton. We miss a cultural understanding. We miss understanding someone's ethnicity, and it's not always color. Like someone who's Black and from Jamaica has a different experience than someone who's Black and from Philadelphia, different than Black and from Nigeria. And so what we miss is an opportunity to do the best by our patient. And yes, it would be great if there were 14% Black doctors like we are 14% in the United States, but that's not the case. It's 5% and lower. So what it means is all of us clinicians have to learn from our patients how best to take care of them is what it means. It means that if I'm from York, PA, and I'm a white man, that I need to understand this Black woman from North Philadelphia. It means that we need our patients to teach us. And that does impact health outcomes. STAT put out an article in 2023 that said 1 Black physician per county could improve health outcomes. It's just a different lens, a different perspective, a different experience that you may bring to the table, that instead of you saying someone is non-compliant with their care, there may be something else happening in their lives that when you bring it forth, someone says, oh, that's it. That's why I didn't see her for the follow-up. That's why she didn't come back. That's why she didn't answer my calls. And it's a different lens that when you have these different groups around the table, we collectively can bring the best care. And that's when everyone can share that experience, their lived experience, and also learn from the patient. It portends for the best health outcome, period.
Dr. Ala Stanford has served as Regional Director for the U.S. Department of Health, overseeing federal health programs and initiatives in Delaware, Maryland, Pennsylvania, Virginia, West Virginia, and Washington, D.C.
What I want people to take away from this book is that it is a book for everyone. And what I mean by that is if you happen to be a Black woman physician, this book is going to resonate with you because we share a similar story. You will not find a surgeon or an advanced practitioner clinician in this country that is African American that did not struggle to get to where they are. There's something that we can all do to acknowledge some of the inequities and bias that exists. And one of my attendings, my staff surgeons used to say, the eyes only see what the mind suspects. And so what I'm hoping in my book is now, because it's all true, it's my life, that now it will be in your mind. And the next time something happens, you'll say, oh, that wasn't right. You know, the sort of, when you see something, say something, that it becomes a teachable moment and a learning experience. So everyone, the next person that's a pediatric surgeon, presidential appointee, and grassroots save thousands of lives, doesn't have to go through quite the path that I did to get to it. So that's who the book is for.
I want to talk to you about the difficulty of the job, that some days you drive home and, you weren't able to save that baby and just how tough that is on you emotionally. And how do you get through that?
Well, in some ways you do have to compartmentalize. You do. And sometimes when that happens and the child still doesn't survive, you have to say to yourself, I did everything I possibly could have done to save. And you have to forgive yourself. And then I think, every doctor is different, you have to be there for the family. Because now the person you were trying to save is no longer here, but the people that are mourning that loss are still here. Sometimes they don't want to see you, right? But you still have to be present and available because they want to ask you questions about those sort of last breaths and last minutes. And I think as physicians, we need to make ourselves available for that. It helps them with the grieving, and that's also part of the healing, even when the patient you were caring for is no longer with us.
There can be no tougher conversation, I would think.
Yeah, it's tough, but you have to do it. I mean, and doing things like that help me sleep at night. It helps me sleep at night. And that's all part of doctoring. Some docs do it better than others. Some have a whole team that does the grief and social work and things like that. But for pediatric surgeons, the parents come to know and trust you. You were the one that they put the life of their child in your hands. So they don't really want to talk to someone else. They want to talk to you.
Writing this, I want to get your thoughts on that. Was it therapeutic or was it a journey?
Yes. So writing this book was therapeutic. It was a journey. The audio was hard. The audio was hard because it took 2 years to write it. But then reading it out loud, so it's your eyes sensory, it's your ears, and then I'm feeling it. So, in the sound room, there were tears that were shed. The sound engineer was like, okay, let's take a break, And so, yeah, it was therapeutic for me. I had to be confident because many of the stories I tell, those people are still living. So I had some tough conversations, but the ones that I knew were going to be tough, I had long before the book was on shelves, right? And I can honestly say for every institution where I had a challenging time, they have all said to me, we should have done better by you. We should not have treated you the way we treated you. And we need you now to help us not make the same mistakes. They've all invited me back to be invited professor. And to me, that's progress.
Well, this is a fantastic read. suggest it to all of you. Thank you so much. Great interview. Thank you.
Thank you. Yeah, okay, yay!